Computer. Okay, we're good to go. So welcome to the Holistic Highways monthly calls, and this is where we look at resources, we talk with experts, and we share inspirational stories. And today's expert is Brandi Seaman, a holistic dental hygienist in the Harrisburg, Hershey area of Pennsylvania. And Brandi is part of the Holistic Dental Association. She's a Reiki master. She is an avid boxer, and she loves to be of service to her patients. And today we're going to talk about what your oral health says about your overall health. This is something I'm really curious about. It's something that Ayurveda addresses too, and I love Brandi's philosophy regarding her practice, and I'm looking forward to talking with you, Brandi. So thanks so much for making the time for this, to be on this call for the Holistic Highway, and sharing your skills, sharing your training, and a little bit about your background. And that's probably a great place to start, Brandi. Tell me a little bit about you, including what you do, and share a little bit about your own health journey too, because you are or have been a client of the Holistic Highway. We've been together a couple of years now. You're off to bigger and much better things, and you're doing phenomenally well. So share, if you don't mind, a little bit about your story, and then tell us how you got into holistic dentistry.
So let's see, to start out, I have been a client for about 2 years of Carrie's. For me, I started out having food and eating issues. I used stress and I allowed it to dictate if I ate or not. Now I am eating 3+ meals a day. I box, and I'm actually moving to Denver, Colorado here the end of April because it's where I feel the best. It's where I feel the healthiest, and it's something that I found through this lifestyle that I now live. I've been lucky to be a dental hygienist and work at a holistic dental practice for 7 out of 12 years of my dental hygiene career. I found this by luck, as well as I feel by the way I was supposed to live my life. I work with Dr. Carol Layton and Dr. Ryan Biener, who Dr. Carol Layton is the holistic doctor who started the niche practice within our practice. And now Dr. Ryan Biener is also certified to do holistic dentistry as well. And through them, I have learned so much and grown so much as a dental hygienist to be able to look at the mouth as a whole, the picture to the whole body, not just the mouth is just one, small piece to the puzzle.
So, Brandi, how did you get interested specifically in holistic health? Because I would imagine you went off to school with the idea that you wanted to help people, and that's very much the medical model. And a lot of people talk to me about oral health and say, but what's that got to do with the whole of your health? Oral health is just teeth and gums, maybe your tongue. Most people don't even think of that. So how did you get into sort of this branch of dentistry?
When I started out in dentistry, it was all about fluoride and that kind of thing. But now, and throughout the years, through seeing that just slapping fluoride on patients wasn't doing anything really, seeing through my own health issues, I started out living in the country. I moved to the city. I started drinking the tap water from Harrisburg, and the chemicals I feel pushed my thyroid into hyperactive issues. And then I started looking into, well, what's in the water? What's in this kind of stuff? And I found that fluoride was a reoccurring pattern. And I was lucky enough to work with my doctor, Dr. Carol Layton, and she left the practice that I had started working at for her journey. And we all organically came back to the same practice at Hershey Dental Associates. And that's where I got my first taste of holistic dentistry, where we talked about pH and we talked about food and diet and all these other things. We went to different holistic seminars, and I got to have tables at certain things throughout the Spirit of Oneness we had here in Harrisburg, Pennsylvania. And that helped me learn about Reiki, which turned me into a Reiki master a couple years later. And it's really interesting how just, one person, one small step can kind of take you very far through your career and through your journey in life and what you're supposed to learn.
Sure, yeah. So we're assuming that everybody in this call, or everybody who's going to see this recording, understands what a holistic dentist is, and they may not. So what is a holistic dentist?
Let's see. A holistic dentist, first, we're natural. We don't use chemical-ridden products in your mouth. Now, we still have to use them to clean the operatories. That is definitely an OSHA regulation that I have to use certain chemicals to clean things, as well as do sterilization things. But in your mouth, we try not to use any toxic chemicals that we can. We try to limit your exposure. We do mercury-free, mercury-safe removal, which is a whole process and protocol that we could talk in length about, which protects you when we remove the mercury. In the hygiene department, you can rinse with ozone water, which is extra oxygenated water that kills bacteria, fungus, and viruses. We also utilize that to just irrigate pockets or rinse you with. We also polish with a pumice. So that's just a ground stone. And then from us hygienists, you get a chance to be counseled on different things, as well as from the doctor. We will counsel you on the pH of your mouth. We'll test the pH of your mouth. We will talk about food and what that does, not only when it hits your mouth, but also when it hits your stomach. We get to do things that you would not get to do at a regular dental practice.
Fascinating. And you talked about this sort of connection between oral health and diet, between dentistry and diet. So is there a connection between oral health and other health conditions?
Oh, absolutely. We're looking so much now at the mouth being the connection to everything. What we put in our bodies and digestion, it all starts in our mouth. From impact that our oral health has, I think that, we're not looking at it, or all dentists don't look at it completely still as being that one whole picture. But more now, studies are coming out to say sleep apnea can be causing, major issues, which starts all in the mouth, as well as diabetes shows its first symptoms in the oral cavity with bleeding and inflammation. Stroke and high blood pressure, if you have a lot of plaque on your teeth, there's a good chance you have a lot of that in your arteries and in your veins. Also respiratory issues, like I was saying, with sleep apnea. If you have a jaw that falls back, it can cause issues with sleep obstruction, and so many other digestive disorders show up in the mouth first through acid reflux, that type of thing.
Fascinating. Now, Brandi, I don't think I've shared this story with you, but I have my own health story, and I was diagnosed actually with mercury toxicity, and I had a lot of symptoms from that mercury toxicity, including a lot of fatigue, a lot of joint pain, I couldn't think straight. Went through doctor to doctor to doctor. Eventually, after about 5 years, got diagnosed with mercury toxicity, and the first thing they wanted me to do was go to a dentist who set up all this sort of vacuum equipment around me to remove the amalgams I had. So are silver or fillings, the regular fillings that people used to get, are they safe? Because there are still many doctors who tell me, oh, you don't need to have those removed. They're never going to, cause mercury problems for you.
This is definitely a sensitive subject. It's definitely one that, is still debated. The American Dental Association is not, in my opinion, ever going to come out and say, yes, this is toxic and it shouldn't be placed in the mouth. I believe we're going to slowly phase it out, and slowly dentists are not even learning it in dental schools as much. So eventually, I just believe it's not going to be being placed, and they're just not going to be talking about it anymore. But yes, mercury mercury is still, it's in every silver filling that you have in your mouth. It is an alloy, the silver filling is, that's what they say. They say once the mercury is combined with the other alloys that it bonds. But we know that mercury gases for over 500,000 years. And so if you have it in your mouth and you are chewing, you are putting your teeth together, you're eating hot liquids, anything like that can cause gassing of the silver mercury filling. And you can see that if you have a guard, some patients wear guards that they grind their teeth. You can actually see staining from the mercury vapors on those, as well as if you have clear plastic orthodontic retainers and other sleep devices can show that there is actual off-gassing from the mercury just through actual visual signs.
So one of the other things that I heard is you have to go to somebody who's very special or who is specialized in being able to remove those amalgams, because it's not just a matter of just whipping them out, because that can cause more problems too, can't it? Can you sort of talk a little bit about the safety around that?
Absolutely. Being and using the right precautions with mercury removals is extremely important. There's many dentists out there, and all of your dentists could take your silver fillings out. They could just do it very quickly and not worry about the vapors that are coming off of it. They may not worry about the mercury particles. The quickest, fastest way to remove the silver filling is by cutting it into the biggest pieces possible. We have special suction units that we also use around the tooth. You're placed under a rubber dam so that you aren't able to swallow or have any of the actual mercury touch your tissues whenever it is removed. And then you also are put on a controlled airway, and then there is also filtration throughout the office in the room, as well as the assistant and the doctors wear masks as well. So we protect ourselves. The hygienists do not, but the doctor and the assistant, while they're actually doing the mercury removal process, protect themselves because they are releasing vapor. So they should also be wearing protection through that too. Our doctors do even test for mercury toxicity themselves, because it's something that they get concerned about, is that they're removing these silver fillings, and it's something that is a good and awesome conviction, but are they becoming mercury toxic due to it as well?
Yeah, wow. So what are some of the biggest misconceptions about dental health in terms of sort of teeth and gums? What do you find that people come in?
I really just think people don't believe that there's any connection to even the whole body versus your mouth. So many patients, if I ask if there's a change in medical history, they say no. And then throughout the appointment, they might tell me that they had a stroke a couple months ago and they're now on blood thinners, but they didn't feel that that had any implication on what I was doing and how that was going to affect what was being done in the chair, as well as what was happening with their whole body. And I went on to explain to the patient that not only the medications that they're on has implications to what I do, but also what happened to them with the stroke. It is correlated with the health of their mouth. And this patient comes in every 3 months to have cleanings, and we just started that, and it's something that I explained to them, if we would have started this sooner, I'm not saying it would have stopped that stroke, but I'm saying we might have kept your dental health healthy, which keeps your whole body healthy. Again, people don't look at your mouth as the gateway to everything. It's the gateway to your health in general, in my opinion. I said before, digestion starts in your mouth. Germs come in through your mouth and your nasal passage. As a dental hygienist, a holistic dental hygienist, I also get to talk about using a neti pot or using like nasal sprays, keeping your nasal passages moisturized, because if your nose is moisturized, so is your mouth. And so I get a chance to talk a little bit more about how everything is connected. And a lot of patients that go to general dentists don't see that whole connection. A lot of the patients that come to our office, once they're there, or they come to us because they see that connection and they want to know how to stay healthy all in general and how to keep their mouth healthy as well.
Great, great. We now know, and there's a lot of scientific evidence to support that gum disease can now contribute and increase the risk of all kinds of disease. So in Ayurveda, we know that gum disease is increases inflammation, or inflammation is ama, that sort of this toxic buildup, and that once we see it in the mouth, then we pretty much know it's throughout the whole system. It sounds like you feel the same way, that once there's inflammation in the mouth, that you see this sort of inflammatory response throughout the whole body. Are there some specific diseases that you can correlate sort of gum disease to? You mentioned stroke and sort of high blood or high cholesterol levels. Are there other specific diseases?
Absolutely. Diabetes, I think I said maybe earlier as well, it exhibits first in the mouth. Type 2 diabetes. I've had patients go get tested and be sensitive or type 2 diabetic because I have noticed that their gums are extra bleeding and inflamed, and they're a healthy young person and they're doing everything that they can for their mouth. As well as osteoporosis. Digestive issues can be caused. Even me, I can personally say, you know, I had issues with digestion because I was not eating food. I was just bypassing my teeth and swallowing shakes. That's not something that is supposed to happen or healthy for your body. And that can exhibit in your mouth and in your teeth. We see patients that come in and they're suffering from so many different other health issues, even some respiratory diseases, and even they're saying that the colds, we don't love to see you if you're sick with the flu, but if you have a cold, they say that if we do a good cleaning on you, sometimes you'll feel better afterwards because we're getting all that dirt and gunk out of your mouth. So I really do believe in cleaning the oral cavity and bacteria out will help you just feel better in general.
So what are some things, well, before we get to what we can do at home, what are some oral health symptoms that should not be ignored? What are some of the danger signs that says, hey, you should go get some help here?
Extremely bleedy gums for a long time, even over a week. If you are flossing, if you're brushing, if you're doing everything that we're going to talk about later, and it's still not getting better, don't ignore that. Sensitivity to pain, to hot or cold. If it lasts more than a day or two, and oil pulling and that type of thing doesn't take it away, see your dentist. Sometimes a metal filling can cause the bleeding, and depending if you're not seeing a dentist that's holistic, they may not correlate that together. But, you know, that's something to ask if you are noticing bleeding in this one spot all the time. Is there a silver filling, or do I have a metal crown that's there? And then you can kind of make your own educated decision on if that's the metal that's possibly doing that.
And what are some, so let's assume that somebody just wants to do really good home health care because they want to stay out of the dentist's office. Not many of us want to sit there with our mouth hanging open. And besides brushing and flossing, because that seems sort of what we're told all the time, you know, brush a couple of times a day, floss after every meal. I'm not sure everybody does that. I don't do that. I think it's always everything I want to do. But what else can we do, Brandi, to take care of our teeth?
I'm a huge tongue scraping person. I have been a big tongue scraping person from the beginning, but it is known to increase your taste if you do it regularly. It is known to kill the bacteria on your tongue. It's known to help keep the pH of your mouth healthier, and it'll give you fresher breath as well. There's so many health nasty things about scraping your tongue that sometimes as a dental hygienist, I can even become obsessive about it because it's just, something that it definitely freshens the breath and makes you feel good in general. Another great thing would be oil pulling. We talk about that a lot at my office, and I do it on my way to work in the morning because it is about a 15-minute drive. I don't need to be talking to anybody on my 15-minute drive. I can just be swishing and then spit it out in my bag, either at work or in my car, not in the sink. That's something you don't want to do. At work especially, they'd probably be really upset if you clog their sink because of oil. But that is when I have found it really easy to kind of work into my schedule or in the shower or something. But oil pulling you can do with just regular coconut oil, or we even have recipes sometimes that we recommend to patients with different essential oils added to it to just give you a little bit of bump and help with the oil pulling that already works amazingly.
And I talk a lot about oil pulling with clients too. And I think there's a sense of, oh, that's one of those weird Ayurveda practices. But do you see a difference with the patients that you have who actually utilize oil pulling? Do you see a big difference in oral health?
I see a huge difference for patients that oil pull, even if they're not doing it absolutely every day even. I notice a difference in patients that are doing it as at minimum of 3 times a week, I will be honest. If they are keeping that oil and swishing, it works as a detergent. It kills the bacteria. It helps moisturize the tissue. It helps increase pH. If patients have other issues, even it helps clear your sinuses because it's killing bacteria in your mouth. And patients will say, and I've noticed that they're easier breathing throughout my appointment if they're oil pulling regularly. So I think that it's extremely something to not think, oh, that's just something, that we don't really believe in at all. It really is something out there that a lot more dental practitioners in general are seeing to be very beneficial in helping reduce plaque level as well as bacteria level in your mouth.
Great. And what about mouthwashes? Do you agree in mouthwashes? I mean, there's sort of commercial mouthwashes out there.
Typically we don't recommend those. I am a big just essential oil fan if you're going to do a mouthwash of any sort. I have heard and I've researched the Trifala Tea mouth rinse. I only recommend that during short periods of time if you have periodontal disease. Periodontal disease is specific bacteria related, and that's when you're losing bone around the tooth. That is something that it really is shown, and research is coming out that it does work almost as well as one of the prescription-based mouth rinses that they prescribe during what we call scaling and root planing, or a deeper cleaning for periodontal disease. It will cause staining of the teeth. It will cause other things, but in my opinion, it's a really amazing alternative for prescribing an alcohol-based prescription strength rinse that kills all bacteria and makes your mouth very not taste good versus the Trifala Tea that really kills the bad bacteria, but it doesn't kill the good bacteria, and it targets the things that it really should. So I think that we're going to be seeing that more used in site-specific areas, but I think it's something that we should be utilizing more in our field.
And we often recommend Trifala tea, and we do it on the basis of just making up sort of a teaspoon of Trifala to like 4 cups of water, heating it up, and then using it like a mouthwash. Would you reckon, would that be within keeping of what you would say is a good idea? Or?
Again, yes, but maybe only like maybe for a week and then kind of taking a break. If you're making your own toothpaste though, I might think it would be maybe a little bit okay. And we do talk about that at my office as well. Making your own toothpaste, you would just have to make your toothpaste a little bit more abrasive so that you're making sure that you remove the stain that the Trifala Tea can cause. But that's my really only concern is the staining. So if you have teeth that don't stain, you would have no issue. But but the tannins in tea stain a little bit more even than coffee do, so you just have to be a little bit careful with that because it can cause some staining of the teeth. So people that would rinse with it regularly would just have to really monitor that for themselves.
So how do you make your own toothpaste? I'm interested.
There's so many different ways to make your own toothpaste. We have recipes from bentonite, from using bentonite clay and baking soda or sea salt, and then you can just literally use baking soda. I have recommended patients to just use baking soda a lot, and you will hear that you need all of these bells and whistles and all these prescription or these fancy toothpastes, and you really don't. It's all about how you brush, the way you brush, as well as what you eat. I have patients that sit in my dental chair that, I hate to say this, maybe don't brush every single twice a day kind of thing that I recommend, but because they have such a healthy eating habit, they don't have to brush twice a day, every day, because they are oil pulling, tongue scraping, eating the way that they should. It really shows, your whole body health shows in the mouth.
Fascinating. One of the things that we recommend in Ayurveda is neem toothpaste. Have you come across that? Do you use that at all, or do you recommend that?
I do. I'm not sure if you've heard of Desert Essence. They make a tea tree, wintergreen, and neem paste. Okay. I love that. I have that in my cabinet. They make a regular neem paste. You can just order plain neem paste as well. And I'm a fan of all of those. There's so much out there that is not good and chemical ridden, that I feel that if you're using a natural toothpaste that you're making yourself, you're going to get a lot more benefit out of it. And I think you're going to utilize it the way that it should be utilized versus kind of just zooming through your mouth. I think if it's something that you make and you like the taste of, or the consistency, or you find something that you like about it, you're going to be more apt to spend a little bit more time in your mouth and take the time that needs to be spent.
Now, what about some of the so-called commercial natural toothpaste, like sort of Tom's toothpaste? Are they okay to use?
I'm not a super fan of those anymore. I used to be, I guess, in the beginning, years ago, whenever I started out, those were the only toothpaste that were available to buy that were natural toothpaste. Some of them have sodium lauryl sulfate in them now. Some of them have fluoride in them. I like to be able to pronounce all the ingredients on my tube of toothpaste. That's something that I find to be really important, and you can't do that anymore with the Tom's of Maine toothpaste. And not to say that it's not at least kind of a better alternative. I feel like that's a better alternative than, Crest, because the chemicals in that and other properties that it has. But if you're going to spend your money on toothpaste and natural toothpaste, spend the money on reading the ingredients, knowing what's in it, and not just a brand that you've kind of heard of before and is a big name that maybe people have recommended.
Now, you mentioned that a toothpaste, a lot of toothpaste still have fluoride in. And what is the problem with fluoride? Because, I mean, when I grew up, everybody was given fluoride rinses. My son, I remember walking out of a dentist office once saying I didn't want fluoride for my son. And he looked at me like I was terrible. My child was going to die because they didn't give him these fluoride sort of mouth rinses. So what happened there? When did that suddenly become taboo to use fluoride, and why? What did they suddenly decide? Because it's still in the municipal water in some places.
It's still in regular dentistry. Fluoride is king. It's queen. It owns everything. It owns life. Fluoride in general dentistry and in regular now pediatric offices. I had a mom of a surgeon at Hershey Medical Center come in to see us, and she said, my pediatrician wanted me to give my kids oral fluoride, but as long as I told them that you guys put it on in here, I didn't have to give them the oral fluoride. And we made sure to explain to her, you know, we don't place it in our office. And she said, I know that's okay. I just had to say to the doctor that you place it to be able to get out of not giving it to my children. And I find that to be ridiculous. It should be something that is researched. There is research out there, pro and con fluoride wise. But I feel like if people would look at the research and the socioeconomic status of where they feel the fluoride really helped, if they would also look at the diet that the people were eating, the fluoride helped, I think they would see that the fluoride was kind of just a band-aid on a much bigger problem, which was carbohydrates and fermentable carbohydrates that are allowed in the mouth. Fluoride is still just a very big thing and being pushed even more sometimes in mainstream. But I think on our side of things, it's definitely looked at, and I'm actually looked at as the heretic in my other dental societies, if I'm not in the holistic dental society, because I am the hygienist who doesn't put fluoride on the kids' teeth. But I talked to mom and dad about everything from the diet that they're eating to the type of vitamins that they're taking. Are they chewing a gummy vitamin and then running out the door with that gummy, sticky, chewy vitamin still in their teeth all day? That quite possibly could be the cavity causer right there, not the fact that I'm not putting fluoride on their child's teeth. So I think that doing research is really important, and looking that up and knowing why fluoride is so big. And it's just, in my opinion, and research is going to show that it's just a band-aid, or it's something that they say is helping, but in reality it's not beneficial in the long run.
So what are the downsides of fluoride? What are the negative effects of fluoride?
First of all, if a child swallows too much of it in the dental chair, it can make them nauseous and sick. We're not supposed to ingest it in general, too much of it. And then we're giving it to kids systemically to hopefully strengthen their teeth enough to not give them cavities. Thyroid is also known to be affected by by fluoride. Our blood filters through our thyroid, and it is one of the most vulnerable things that the thyroid can process is fluoride, and it can cause a lot of issues with our health. Another reason why I'm against water fluoridation is because it should not be systemically given to us after we're 12 years of age, and we're pumping it through our systems 50, 60, 70, 80 years later. And it is not enough in our water system to help topically. So I guess we're just searching to hit that age range of 0 to 12. And then after that, in my opinion, it's a poison that we have in our water that we're dealing with. So research out there does show that, but I do, even in my office, tell patients to research it themselves, because there are pros and cons, and I want someone to come to the knowledge themselves and not just by something that I feed them.
Yeah, okay, and that makes sense too. So walk us through a typical day, if you like, and this is probably a good place to sort of end and then hand it over to any questions. What, in care of our mouth, what would be a good typical day? So we get up in the morning, we crawl out of bed. What should we do first?
I guess the first thing that we should do in the morning, there's a lot of things that are good to do, but maybe just first, swishing with some water, drinking some water is a really, really good thing. Then start by using a tongue scraper. That's something that's really great to do after maybe you have a good cup of water, or you can do it before you have your good cup of water. Then brush your teeth and do your rinse. I am a fan of brushing and rinsing after you eat your meal, but I'm a fan of tongue scraping first thing when I get out of bed. It kind of removes that sticky layer, depending on, if you maybe have a cold and you're breathing through your mouth, or you're just a mouth breather, getting up in the morning, scraping your tongue, and having a good glass of water is always something great to do. Then after you have your breakfast, I'm a big fan of brushing your teeth and rinsing. I oil pull on the way to work. Technically, research out there says the best time to oil pull is on an empty stomach. I completely agree with that. If you have time in the morning to do that when you wake up, make time and do that. But if you don't have time to do it, squeeze it in sometime throughout the day. Get that oil pulling in however you can, even if it's not, the first thing that you do when you wake up on an empty stomach after you've tongue scraped. In my opinion, in dentistry, it's important to get it all done and make sure you're doing it, not specifically times, but how do you feel the best and when works the best for you for the oil pulling. So in the morning, most people are going to just wake up, scrape their tongue, maybe eat breakfast, brush their teeth, rinse, and walk out the door.
And how about evening?
In the evening, I'm a big fan of oil pulling actually in the evening for patients that would have dry mouths, for patients that maybe have other respiratory issues, or even just have food that sticks between their teeth. You're eating all day long. Again, yes, no, most of us are not flossing after every meal. Even a hygienist here does not floss after every meal. And I know, I admit to what I don't do sometimes, but it's important at night that we're cleaning all the bacteria out of our mouth. I will tell patients, and that's where the patients who eat a healthy diet and come in and maybe don't brush twice a day, they're brushing that nighttime brush. And that's helping remove all the bacteria, the food particles, everything that they can from their mouth. If you would have time then, that would be my choice in oil pulling, again, like I said, for certain patients, but in the morning for other patients. And then making sure that you spit that oil out and you're getting to bed and getting a good night's sleep. But I'm a huge fan at nighttime of doing the brush and the floss if you want, and then oil pull afterwards. That would be awesome for your nighttime routine.
Yeah, definitely. And it hydrates too. So that's going to be really nice. Brandi, you've given us a lot of information, so that's great. So I want to turn it over to anybody else that's on the call tonight. Do you have any questions for Brandi? Here's your opportunity to talk to a holistic hygienist about any questions you may have.
Yeah, this is Kim. And Brandi, all the information you shared was absolutely very interesting. I have a question about essential oils. You had mentioned that sometimes you mix it in with the oil. What essential oils would you recommend for oral health?
Tea tree oil is a really good oil that kills bacteria. It's astringent, so it's that antiseptic too. Clove oil is fantastic. Peppermint oil is really for taste. You don't have to utilize that unless you want that for taste. But really the two that we recommend the most is tea tree oil and clove, because those are the best in what we want to do for the mouth, which is kill bacteria, be astringent, and really help heal and soothe the tissue.
Okay, great. My other question is, are you aware of any other dentistries along the East Coast? You're not far from me. I'm in Maryland, that also are holistic?
Yes, there's a great website. It's the IAOMT.org. That's the International Academy of Mercury and Toxicology. And that is where our dentists go to get certified for mercury-free, mercury-safe removal. On that website, there should be a dentist locator somewhere on there. You'll be able to either enter a zip code or enter your zip code. And then that would help you find a practice maybe closer to you. There are a lot of dentists throughout the East Coast. It's just we are spread out. So you may have to travel an hour to 2 hours to a dental practice, depending on what your location is.
Okay. And what's the website again?
IAOMT.org.
Okay, thank you.
MT.
Yeah.
Okay. And that stands for the International, can you say that again?
International Academy of Mercury and Toxicology.
You know, traveling an hour to see a holistic dentist is probably most of us would do.
Yeah. We have patients that will travel for 4 hours sometimes to see us, depending on their location and what dentist they're looking for. Holistic dentists as well each hold their own philosophy. They each have their own theory and thought process. So my recommendation to you too is do research on the dentist. Look at their website, even see if they maybe do say what their philosophy is. We don't love phone calls asking what our philosophy is about it because we don't have a ton of time to spend on the phone with you because we want to get you in the office to spend that time with you. But the doctors all kind of vary just a tiny bit on what they believe. So you may find one dentist that doesn't quite fit your style. Always keep looking because just like regular dentists, us holistic dentists might not be that piece to the puzzle. You might need to find someone else to kind of fit into that piece of the puzzle. So know sometimes driving a distance is worth it because you'll find the right fit that you should have for even your dental health. You know, we look at our whole body health that way, but I don't think people look at their mouth needs to be that way too.
That's a good point. Yeah. Great questions, Kim. And any other questions for Brandi? Then what I will do is I will get a recipe from Brandi for a natural toothpaste and send it out to you, to everybody, so that they have it. Would that be something you would like?
Yes.
Okay, terrific. Then Brandi, you know, you have been great. Thank you so much for giving us your time. You freely gave it tonight, and I know you're busy, and I know you want to get off to boxing, but thank you so much. And,
thank you, Carrie.
And remember, we do these calls once a month. For this year, they're going to be the last Monday in each month at 7 o'clock, and I'll send an email out just like I did before. And next month we'll talk about the winter blues, especially seasonal affective disorder, very prevalent this time of year, and we'll talk about what Ayurveda says about that and some things that you can implement so that you don't feel quite so down. As we get into February and it's still cold and there's still no sun, we can often feel like we're sort of trudging through that winter. So we'll talk about that next month. Brandi, it was terrific as always, and I'm sure I'll be talking to you soon. You take care, love. And I'm going to close out, so say goodbye to everybody. Bye-bye.
Bye, thank you. Good night.
Thank you.